Councilmember Rivera, now Elisabeth referenced this, but how was CARES Act money distributed to hospitals, and how did that distribution contribute to rich hospitals just getting richer and poor hospitals getting poorer?
I think the problem that Elisabeth also kind of alluded to is that there is a very, very problematic formula to begin with. So right now, the way that charity dollars or the way that the indigent care pool is addressed amongst our hospital system is very, very unequal. So we have our public hospital system essentially kind of scraping for every single dollar that they receive. So some of the numbers that you heard, which are incredibly startling, unfortunately is not the biggest surprise for all of us, because pre-pandemic, we knew this was a problem. You know, I've had in my capacity as hospitals chair hearings on charity care, on how to deliver culturally competent care, but always addressing the problem with the finances, always addressing how the Greater New York Hospital Association is always just slightly better off when it comes to their network. And yes, they mention all the time that health and hospitals is a part of their association, but it is very, very different in how, in terms of their outcomes. So right now, the formula, or I would say the funds that are trickling down to our hospitals, as you heard, was Manhattan heavy. And I think what's really, really troubling is when we saw what was happening in our communities that clearly were disproportionately impacted by COVID, did not receive their fair share. And historically, these are marginalized neighborhoods. Historically, they're underserved when it comes to medical services. So when we saw, you know, our seniors, those with hypertension or diabetes going to the hospital and dying at higher rates, we were hoping that this would be at least the alarm that we're ringing, this urgency to do better. I don't know what the future is going to hold. I think clearly we need to pass the New York Health Act so we can start right here in our own home state. And then, of course, hopefully with the new administration, we'll have a much, much better federal system to support those that need it the most.
We're going to get to the New York Health Act, I promise. Senator Rivera, I heard that one Manhattan hospital got like $119 million in CARES Act funding, while all of the other health and hospitals institutions put together got $45 million. Is that the case, or is that?
I actually think it was a much bigger difference than that. I know that I will want Elisabeth to just mention the numbers a second, because she's the numbers.
So
she has them up top of her head.
It's been updated.
Just I
think I'm off mute now. I think it's been updated. So each health and hospital has received $68 million.
Okay.
And that sounds like a lot, except when you realize that New York Presbyterian got $570 million.
Okay. So let's linger on this for a second.
I'm supposed to have that face because I'm a moderator, but I'm sorry.
So but that face, you made that face not because you're a moderator, but because you're a common sense human being who sees a rich institution receive hundreds of millions of dollars more than an entire public health system. Now, the city of New York, the city of New York, the biggest single provider of care to the poor and vulnerable populations in the city is the Health and Hospitals Corporation. So it is the public hospital system. And Carlina made it, Councilmember Rivera made it very clear. This is an entity that all of them separately, like for example, Lincoln Hospital here in the Bronx, you've got North Central Bronx here in the Bronx, Elmhurst Hospital down in Queens, etc. All of these entities provide care for the most vulnerable, and between all of them, about a little bit more than a tenth of what one wealthy institution in Manhattan received. And this is the type of thing that we have to linger on, because that just speaks to the fact that the way that the language was written at the federal level kind of perpetuates distinctions and differences that already exist and are baked in. So it is horrible.
All right. So, Senator, how did this inequity affect St. Barnabas, which is, I think that's in your your district. At least it's in the Bronx. And over 90% of the people who go to St. Barnabas have to pay via Medicaid rather than Medicare. So what does that mean?
So in the case of St. Barnabas, they're between, because there's federal support that has been granted to them, but a big chunk of it, over $100 million of it, is terms unresolved. So we're talking about loans or CARES Act money that we're not exactly sure how they're going to get, when exactly this is going to be paid back. Now there is $48 million that they received, that they received as of right now. There's a lot more that potentially they could receive, but in comparison, again, to rich institutions in Manhattan, which is the number that Elisabeth mentioned earlier, is also important to understand. We have a population in Manhattan that is the most overbedded and overbedded, as in there are more hospital beds available. And just so that people understand, when we talk about hospital beds, so a hospital bed refers to an available space for someone that potentially might be hospitalized, right? And so when there are places that, when you're saying like, oh, there's 100 beds in that institution or 50 beds in that institution, that means that they have the capacity to have at a time a certain number of people hospitalized. So when you take a population, as in Manhattan, which is wealthier, it is whiter, it is certainly, and the fact that that population has a far different number of beds potentially available to them, then under normal circumstances, it's bad enough. But then you take a crisis moment when you already had differences that were baked into the system, racial inequalities that meant that that whole communities were unhealthier by default.
Right.
And then you take a virus that, although the virus does not discriminate, the systems that are supposed to protect us from the virus absolutely discriminate. And so we saw that in the results of how many people died and how many people wound up in hospitals and how many people were sick from it.
I want to get to Theo in a minute, but Elisabeth, the way the CARES Act formula was created at the federal level, that contributed directly to this inequity, did it not?
It did. So, my heart, I get it, what they did. That the fastest way to get the money out from Health and Human Services perspective was to just do it based on Medicare payment. The problem is that the pandemic, that isn't a fair way to distribute the money, especially given who the pandemic was hurting hardest. And that was lower income people, essential workers. And so what they should have done, which they could have done, is allocated the money based on Medicaid, where the Medicaid payments were flowing or where the disproportionate share hospital funds were flowing. That would have been a much fairer way to, based on how many patients who are Medicaid or uninsured or self-paid. That would be a much fairer way to allocate the funds, because the fact is, New York Presbyterian mostly has commercially insured people. If they got COVID, they're covered. In Queens, if you're uninsured, if you're an immigrant and you don't have coverage, you're not covered. So we want to support Elmhurst, who's doing the lion's share of the work for the people that aren't covered and affected by the pandemic. And why? Because this is a pandemic. And people move around and everybody can get sick if we don't give people the care that they need when they need it, or else everyone's going to get sick, which is essentially what happened. And I think it's important to note that most people in Manhattan who would go to New York Presbyterian fled. They went to their second homes, right? So, not most people, but a lot of people. So when you walked around Manhattan at the height of the pandemic, it was often empty. And I'm talking about Manhattan below 96, below 100th Street. And, just to be clear about, not all of Manhattan is rich and white, but the people that tend to go to New York Presbyterian are. And, look, I don't mean to be picking on New York Presbyterian. NYU got, 427 million versus Bellevue, that got an average of 60 million. Or, Mount Sinai got just a mere 263 million. So, they had it really hard. But, it is pretty upsetting when you think of how little the individual health and hospital facilities got.